Moderate to severe dry eye has many causes.
I'm a bookkeeper, and I spend a great deal of time looking at computer screens and reading reports, and which is staring. And if your eyes are dry, they will burn and ache and hurt really bad, and you'll just simply want to close your eyes and tell the world to go away. But you can't make a living with your eyes closed.
It interferes with anything that you normally want to do.
Sometimes I wake up in the morning and my eyes are so painful that I think of it to myself as that they're screaming.
Susan used to be a book editor, but she had to go on disability, in part because of the symptoms of her severe dry eye disease.
It can pretty much ruin your life at its worst, because you're in so much pain, you can't read, you can maybe watch TV, you can't use your computer, but not reading is just awful, awful. And there's a limit to how much time you want to spend watching TV. And it's hard to go out if the sun is shining because your eyes are so sensitive to light.
Susan says her symptoms are under control because her physician prescribed Lacrisert, also known as hydroxypropylcellulose ophthalmic insert.
Oh my God, does it work for me? Because it works right away and it just keeps on. It lasts more than 12 hours.
Lacrisert is a different kind of treatment for moderate to severe dry eye, including patients who have keratoconjunctivitis sicca. Lacrisert is indicated especially in patients who remain symptomatic after an adequate trial of artificial tear solutions. Lacrisert is a sterile, translucent, rod-shaped, water-soluble medication for administration into the inferior cul-de-sac of the eye.
Perfect. Now you just want to basically dunk it inside that inferior sac. Push it inside a little bit deeper. Beautiful. And slowly let go.
Unlike drops, some of which may have to be reapplied throughout the day, most patients achieve sufficient results from Lacrisert by using it only once a day. Individual patients may require more flexibility and require twice daily use for optimal results.
Barbara, put your chin right here. Lacryserts are for patients with more severe surface keratitis who has significant staining with fluorescein and possibly filamentary keratitis.
In his clinical practice, Dr. Arden Hale-Wander says he has seen progressive visual deterioration, which occurs in some patients who suffer from moderate to severe dry eye, retarded, halted, or sometimes reversed in patients using Lacrisert.
The Lacrisert may improve their vision and discomfort by improving the surface keratitis.
Dr. Wander, who is on the faculty of the University of Cincinnati, says because of the evidence he has found in his clinical practice, he often prescribes it for patients suffering from moderate to severe dry eye who wear soft or even hard contact lenses.
Patients with keratoconus, a disease in which the cornea is misshapen and shaped like the front end of a cone, must wear rigid contact lenses because glasses and soft contact lenses do not improve their vision. Rigid, gas-permeable hard contact lenses enable them to see. Again, these lenses are not well tolerated if the patient has dry eyes. A number of such patients may be able to tolerate their contact lenses if they wear the lenses with Lacryserts.
Many of the patients suffering from chronic moderate to severe dry eye are postmenopausal females.
I just could not function without Lacrisert, truly.
Not all patients who use Lacrisert will experience this level of relief. One of the benefits of Lacrisert therapy is that it is preservative-free. Though once daily dosing is convenient for patients, Lacrisert also stabilizes and thickens the precorneal tear film. It also helps delay the breakup of the tear film, and for patients that may mean increased comfort. One of the keys to a successful outcome for patients on Lacrisert therapy is proper placement of the insert. We encourage you to show patients a special video we have prepared for them. Instructions for inserting and removing Lacrisert should be carefully followed. It's also a good idea to have them use Lacrisert in your office for the first time before you send them home. Like inserting contact lenses, it takes a little bit of practice before it becomes routine. After the patient has washed their hands thoroughly with soap and water, you should set them up at a convenient place, such as your contact lens station.
So if you lean into the mirror, make a pocket, and then I want you to take the Lacrisert and place it down in the pocket. Just like that, all the way down.
The Lacrisert applicator should be rinsed under hot water before each use and then shake off the excess. Instruct them to open the Lacrisert sample and pull out 2 doses. They should then open 1 dose at a time. This is important in order to maintain sterility. The blister pack should be opened carefully on a flat surface so that the dose does not become dislodged. The patient should use the flexible applicator to pick up the dose, then with the other hand, gently grasp open their lower eyelid, creating a pocket, and insert the dose deep into the lower cul-de-sac beneath the base of the tarsus. Failure to insert the dose deeply enough below the edge of the lower eyelid may result in ejection of the dose. While this is not necessarily harmful, it will result in wasted medication. If Lacrisert is ejected, instruct the patient not to try to reinsert it. They should start with a fresh dose to ensure sterility. Patients should also be advised to place the dose far enough away from their cornea to avoid a corneal abrasion. You should also tell them not to rub their eyes after putting in Lacrisert, and remind them that proper insertion takes practice, and once they get it down, this will become a simple part of their routine.
Takes an initial instruction that I spend about 5 minutes with them in the office, and after a first few attempts they get used to the insertion. It's very easy to do. They love it, and they come back the next time and say they've made their lives a lot easier because they only have to do it once a day.
Dr. Penny Asbell is a professor at the Mount Sinai School of Medicine. She is also the co-author of a textbook on dry eye disease.
Lacrisert is a great product. It's not preserved, and once you put it in the morning, it can last the entire day. So it's really something that's nice to offer patients who are having chronic pain from dry eye disease. However, you need to teach a patient how to use it. You know, when we tell somebody they're going to have contact lenses, we don't just give them to them and let them out the door and not teach them how to use it. Just like that for Lacrisert. You need to teach your patient how to put it in. You need to tell them that they have to practice at home. And typically, after a few tries, they get very used to it. They can put them in easily and get very effective benefit from using the Lacrisert.
Patients may start experiencing relief with their first use of Lacrisert. In some patients, several weeks may be required before satisfactory improvement of symptoms is achieved.
Most patients will find relief within the first week. Sometimes it depends a little bit about just how dry the ocular surface is in your case, but we hope that you'll find some relief within the first week to first 2 weeks.
Even some patients with dexterity or coordination issues get used to inserting Lacrisert. Cynthia has severe rheumatoid arthritis and says she has no problem administering Lacrisert.
I'm a graduate student and I need to read a great deal. I write, I use the computer. Before I started Lacrisert, I had lost my capacity to read and to watch television. My eyes were painful and uncomfortable 24/7, and artificial tears were of little benefit. You could pour them in once every minute and my eyes were still painful and dry.
Although this experience may not be typical, many patients do experience substantial relief. For some patients, you may need to instruct a loved one or caregiver in the proper insertion technique.
There it is.
The process is basically the same, and you should explain to the caregiver that they should avoid getting Lacrisert too close to the colored part of the eye so as to avoid a corneal abrasion. You can feel confident prescribing Lacrisert because it has been on the market for many years. Both its risks and benefits are well known. They include transient blurriness, some eye discomfort or irritation, matting or stickiness of the eyelashes, sensitivity especially to light, edema or swelling of the eyelid, and hyperemia or bloodshot eyes. Improper placement of Lacrisert can lead to corneal abrasion.
We have the Lacrisert in good position. Blink.
Another advantage of this therapy is that because Lacrisert is preservative-free, it allows patients who may be sensitive to preservatives to experience relief of their dry eye symptoms without the risk of potential side effects related to the preservatives in other products. Before going to bed, much as they would with contact lenses, some patients like to remove Lacrisert. This can usually be done by taking a clean tissue and pressing gently on the lower eyelid to expel any unused Lacrisert. The tissue should then be thrown away.
Well, actually, Lacrisert is approved by the FDA and has been around for decades. Now, some patients have been loyal users day in and day out and have great results. But we haven't seen as many people use it as maybe who could get an effective and good result. And one of the problems is learning how to use it. And the problem there actually starts in the physician's office. If he or she doesn't know how to use it, they're not going to be a good teacher for their patients. So one of the things we'd like to do is have physicians and their staff in their office understand what Lacrisert is and how to effectively place it, and provide that information to their patients so that they can use it effectively as well.
For full prescribing information, just log on to Lacrisert.com.